डॉक्टर म्हाका एक फुडलो प्रश्न आयलो आसा. हॅलो.
Hello.
Yeah.
Doctor, I'm speaking from Nuve.
Yeah.
Yeah. My husband, one nail had pricked on the back, on the shoulder. So the heel, it has healed, but it is itching him sometimes, not always. So it should be that there's a certain boil like that part, swelling. So it's itching him. It should be removed or?
No.
Since how long it is there now?
2 years.
Okay. And now the wound has healed and it has the skin has become slightly raised on that.
Yeah, slightly raised.
Color has become little darker.
Yeah, little different. You can make out.
It's a little darker color.
Yeah.
And that raised portion is little thick.
Yeah.
Okay.
So is it something to worry? It should be removed or let it remain like that?
Yeah. Doctor will address this.
Yeah. See this when the skin becomes little thicker, it's called a keloid. Now these things, it's basically nothing much about it. It's only a scar which has become bigger in size. Okay, so keloid, as you know, it's a hypertrophic scar, means the skin scar which has become little bigger. So, and even if you try to remove it, it will tend to recur, it will come back and again it will become thick. So there are some modalities where like cosmetic surgery where the carbon dioxide, snow and all those things and other things, measures are there to lasers and all to control it. But that is only if it comes on the any prominent part of the like the face and all where you have to do so. Obviously it is causing some cosmetic problems. It's on the back and all on the shoulder, you can just leave it alone, don't bother about it, because anything you try to do with it, it will always recur and it will come up. So nothing to worry, it's not a disease, it's just a
scar which is hypertrophic.
Hypertrophic scar, which is normally when the wound heals, it forms a scar. Here the scar has become little bigger. Only care he has to take is anytime he gets any wound anywhere, anytime in his lifetime, he has to go to the doctor immediately and get that wound treated. Even a small wound like a small cut, because if he doesn't take proper care, at that wound again a new scar will form which is similar to this like a keloid. So the person who has a tendency to form these keloids, it can happen again for any wound. So any small wound, any cut, any burns, anything, immediately he has to go to the doctor and get it treated, so that he should not neglect any small wound. Even a small poke anywhere, he should always treat it. Okay, but best thing is leave it alone. If itching is there, some ointments can be given for it. Some steroid ointments are given, so that will take care of the itching part of it. But best thing is to leave it alone.
डॉक्टर आता हो प्रश्न मातसो थोडोसो ड्रॅग करता. म्हाका सांगा, यू मीन टू से जशें देर आर सम म्हणजे टेंडन्सीज लायक हू डेव्हलप द किलॉइड. म्हणजे एका मनशाक समज एका कडेन किलॉइड जाला जाल्यार ताका दुसरे कडेन समज घावो जालो जाल्यार अशा मनशाक किलॉइड जावपाचे जशें तुमी सांगले ते चान्सीस चड आसता.
म्हणजे ती इनबॉर्न टेंडन्सी आसता किलॉइड जावपाची.
अच्छा. म्हणजे वॉट इज द कॉज ऑफ दॅट? म्हणजे काय अशें ते म्हणजे एक्झॅक्ट कॉज अशी खबर ना, पण इट इज अ
कॉज म्हणजे थोड्यांची टेंडन्सी असता. पण कॉमनेस्ट कॉज म्हणजे इन्फेक्शन जर ते जालें त्या वूंड घाव्याक जाल्यार ते किलॉइड जाता. जर तो वूंड ताका केन्नाय फुडें जालें, जर ते रोखडें जर ट्रीट केलें, ताका प्रॉपर एंटीबायोटिक्स दिले किंवा प्रॉपर क्रीम लावन दिवन सारकें जर ट्रिटमेंट जर केलो जाल्यार किलॉइड जावचें ना. पूण जर ते मातशें निग्लेक्ट जर जालें, घरगुती कितें वखदां ट्रिटमेंट जर केलो आनी बेटे हाडून कितें फार्मसींतल्यान ट्यूब लायलो कितें लायलो, तो वूंड पेकतलो पूण ते किलॉइड जातलो.
मागीर डॉक्टर आमकां एक प्रश्न आयलो आसा. हॅलो.
Hello, doctor.
Hello. Yeah.
Good evening.
Very good evening.
Yeah, I'm calling from Salset, myself Talaulikar. I just wanted to ask one question. My brother, he's 26 years old.
Yeah.
And he's getting all pimples all over his body, very big pimples, and he's getting pus also in that. So when it comes, it pains very badly. So why exactly it is? And he's having oily skin also. So may I know what can be done?
And what is his job? What is his profession?
He's working in a company.
In a company where there is means what type of work exactly means? Does he have to sweat a lot?
His job is like sitting. No, AC. So he don't sweat a lot, but he is in AC. So I don't know exactly why it is happening.
Is it
27 years old?
Is it in a industrial this thing set up?
No, doctor. He's working in Bangalore actually.
In a office?
Yeah.
Not office attached to a industry or a factory or anything?
No, nothing like that.
He doesn't have to go to supervise and all that?
No, nothing like that.
Okay. How old is he?
He's 27 years old.
27 years?
Yeah.
Okay. He has done any treatment for these pimples?
Actually, he had gone many times. He applied many tubes and many lotions, but nothing is working out, because he's getting all the pimples on chest, on back also, even hands, legs, and it comes big ones, and then it pains very badly, and all pus comes out. And after few days it dissolves, but it comes now and then.
Okay. Has he been regular treatment with the doctors in Bangalore?
No, he has not, because what happens, he doesn't be there. He comes to Goa, and then it becomes like there's a clash in timings and all that appointments. So he cannot take a regular treatment kind of stuff.
Okay, so that is the main cause of his this thing.
Yeah.
This disease will remaining for a longer period.
Okay.
So the pimples, normally they come around 12-13 years of age, but sometimes it can start at 15-16 years, and they last till 25-26. So around 27, he's now almost the pimples will go. But the thing has remained for a longer period is because this treatment has not been proper.
Correct.
So first thing is that this pimple, one thing I'll tell you, it cannot be treated very fast. He has to do treatment at least for minimum 2 to 3 months. Minimum 3, sometimes more. Now if he is getting a lot of pus film, and the sides of pimples are not only the face, it can come on the chest, shoulders, and on the back, upper back. So whatever he is getting are the sides of the pimples, nothing different about it. Every gets pimple during in the sides, the face, the chest, back, upper back, and the shoulders. So first thing is, he should not fiddle with them, never squeeze them, as I told earlier also, never squeeze them, never fiddle with them. Wash his face frequently, at least 2-3 times a day with soap, or any face wash will do, so that the face remains less oily. It should not remain oily. Secondly, untoward cosmetic should not be used on the face. Now regarding this, when there is so much fat and all pus, that means there is a lot of infection. He has to be put on systemic, that is oral antibiotics, tablets has to be taken. For that, the dose and all that antibiotics, there are various antibiotics, minocycline, doxycycline, various types are there, that has to be decided by the doctor. So he has to, one thing is very important, he has to consult a doctor. Without a doctor seeing him, it's very difficult to tell.
There are two aspects. One is that he should consult a doctor and he should take the treatment regularly. As you rightly told that it may take even 2 to 3 months.
3 months or sometimes even 4 months.
I see.
Sometimes even this stage, we give something called as isotretinoin. Isotretinoin ते वखत नाही, ॲटलिस्ट एक वेळा 3-4 महिने सुद्धा दिवचे पडटा.
अच्छा.
म्हणजे पहिले हाय डोस सुरू करून पहिले डोस लो डोस कमी सुरू करतात, मागीर तो डोस मातसो वाडयतात, एक पीक डोस मागीर तो पडतो हळू कमी करून ते बंद करतात. सो ताका आमी सिस्टीक ॲक्ने म्हणटात, मोठी जाता ताका. पूण हे सगळें एक 3-4 महिने सुद्धा करचें पडटा. सो ते अंडर डॉक्टर्स गायडन्स ताणें सारकें, तो जर गोंयान येवंक शकता जाल्यार ताणें गोंयान येवन करूंक जाता, नाजाल्यार बेंगलोराक खंयच्या स्किन स्पेशलिस्टाक मेळून ताणें करूंक जाय. पूण एखादी 10 दिसांनी 15 दिसांनी ताका डॉक्टर आफयता त्या प्रमाणे सारकें वचून एक म्हयन्यांतल्यान 2 तरी ताणें डॉक्टरा कडेन वचचेंच पडटलें. हें सारकें ट्रिटमेंट करून ते कंट्रोलार हाडूंक शकता.
म्हणजे रेग्युलर फॉलोअप रिक्वायर्ड. डॉक्टर आमगे फुडलो प्रश्न आयलो आसा.
Hello.
Yeah.
Doctor, I'm Betta Fernandez from Nuveen calling.
Yeah, Betta, bye, Sam.
Yeah, I'm 54 years old and I get all rash on my body.
On your body?
It's allergy, like when dust and all comes, also I get that allergy. So I need
so you feel itching? Is there rash? What is the
Yeah,
problem?
I get some rash and it itches me very badly.
What time of the day?
Pardon?
What time of the day?
When I dust the house or I do something outside, the gardening and all, no, like that, then I start, my body starts scratching.
आणि दादोडशे येता ते?
Yeah, I get some boils and then after some pus also forms.
Okay, and then boils remain and they go on their own?
No, if I apply something, then they go off.
What do you apply?
I apply some ointment from the pharmacy and all.
No, but exactly what?
Like Cleopat GM.
Correct.
One ointment I just brought because I don't know whether someone bit me also, because now I have 2-3 boils and they have become very hard on the side.
Okay, they are on the open areas of the body or also on the closed areas?
Yeah, open areas.
Open areas.
My palm, on the side of my palm and on my leg. I don't know if someone bit me also in the night, some insect or something.
Okay.
Yeah.
So
I would like you to suggest me something.
Okay.
Yes. See, now to suggest a cream, no, don't use this Lobet GM. They are very high potent steroid creams. They can cause side effects. So unnecessarily don't use that. Now it can be treated, but the doctor has to see you for it. Okay, so there are various types of this allergies. Now whether it's a bite, then the treatment will be different. If it's because of the dust and all as you are going out and all, it could be different type of treatment. So you have to consult a doctor, but it can be treated. So the boils, if there is little infection, then sometimes some oral tablets has to be given, and anti-allergic tablets has to be given. So main thing is you have to consult a doctor, and especially skin specialist, and in their local area wherever you are staying, and get it treated.
And one more very important message is that she should not go for self-medication.
Yes, don't go self-medication.
Don't buy the medicines from the counter from the pharmacy just by thinking, okay, this has given me relief last time and it will give me relief for the future.
There are certain cases where these medicines have been used and they cause a lot of side effects, and these steroids, high dose of steroids, when they applied on the skin, they can get absorbed from the skin and they go in the blood, and then they cause a lot of other side effects. I have seen such cases like that who have done self-medication, and patients have got other problems because of the steroids. The body resistance have gone down, we call immunity, they have gone down, and then they get a lot of infections and all, and difficult to control it. So please don't go for the self-medication.
Doctor, hello.
Hello.
Yeah.
I am Rupali Aldankar from Miramar.
Yeah, Rupali bhai सांग.
म्हाका एक प्रश्न विचारपाचो आशिल्लो.
विचार.
माझ्या घोवाक न्ही पांयाक ऑन द फूट नियर द हील एक ल्हान पॅच कशी जाल्ले, ताका बारीक पुळी कशी आयिल्ली, इरिटेशन आशिल्लें, ताका स्क्रॅचिंग जातालें, इचिंग. दीस वॉज अराउंड 7 months बॅक.
अच्छा.
आणि ते मागीर डॉक्टराक कन्सल्ट बी केले, ताणें मेडिसिन दिल्ली. रायट नाव आय डोंट हॅव द प्रिस्क्रिप्शन, बट ताणें ट्यूबूय प्रिस्क्रायब केल्लो हेलोवेट, आणि तो गरम उदकान पांयान धुवन मागीर तो लायतालो, पण ते अजूनही क्युअर जायना. म्हणजे ते पॅच मातशें आतां वाडला, ती पुळी गेलात, बट दॅट स्किन कलर ऑन दॅट प्लेस इट इज लिटल डार्कर दॅन द रेस्ट ऑफ द दिस.
अच्छा, आता एक प्रश्न विचारता, शूज वापरता, सॉक्स वापरता, चप्पल वापरता?
सॉक्स घालतकूच ते चड इरिटेशन स्टार्ट जाता, म्हणटा चडशे सँडलच घालता. सॉक्स घालून तेन्ना जेन्ना सॉक्स काडटा न्ही तेन्ना ते खाज ताका वाडता, ताजी खाज.
ते दोन्ही पांयाक आसा काय एकच पांयाक?
एकच पांयाक.
ओके. आता ते ताका खाज येता?
हय, सध्या खाज येता, आणि आता न्ही सोलाचेर मातशें ते हे जाता,
स्प्रेड जाला.
सोलाचेर एक ल्हान पॅच कशी आयला, पण तो अजूनही इचिंग जायना, पण तशीच दिसता. तो लुक्स लायक द सेम कलर.
ओके. आणि तुम्ही आता हेलोवेट बी दिले ते कोणी स्किन स्पेशलिस्टान दिल्ले?
हय हय.
ओके. ती पुळी आशिल्ली ती गेली?
पुळयो गेल्यो.
पुळयो खूब आशिल्ल्यो?
ना, बारीक बारीक अशी थोडी 1-2-3 बी तशी आयिल्ली ती.
आणि ते हेलोवेट कितले तेप लायले?
आता खूप तेप लाय जाले ते, म्हणजे एक ट्यूब काबार जाले की दुसरे हाडला.
हय, म्हणजे
2-3 महिने जातले.
2-3 महिने हेलोवेट चालूच आसा?
हय.
बरें. मागीर तुमी ते दोतोराकडे वचूंक ना? ना. ओके. सो पयलीं म्हणजे हेलोवेट इतले तेप चालू दवरूं नाका, कळ्ळें न्ही? तो एक व्हेरी व्हेरी पोटंट स्टिरॉयड. आमी क्रिमी स्टिरॉयड लावंक दितात पळय, तातूंतले सगळ्यान टॉप मोस्ट स्टिरॉयड म्हणटा तो हेलोवेट, आनी ताचो खूब सायड इफेक्ट आसा. सो पयलीं म्हणजे त्या दोतोरा कडेन पयलीं तुमी वचूंक जाय, आनी ताका तो हेलोवेट पयलीं बंद करूंक जाय. फर्स्ट काम तें. आनी हेलोवेट लावन तें कमी जावचें ना, उलटें तें चालूच उरतलें अशें तुमी चड 2-3 म्हयने लायलो जाल्यार. कित्याक मेन दुयेंस कुशीकूच उरता, स्टिरॉयडाचे सायड इफेक्ट येवंक लागता. एखादी ताजेर मागीर कमी जावन तें फंगस इन्फेक्शन जावंक शकता, आनी एकाच सायडीक जाला पांयाक म्हणजे चड करून एखादी फंगस आसूं शकता. सो फंगस आसल्यार ते मागीर एंटी फंगल ट्रिटमेंट बी करचो पडटा. पूण म्हणून तें वाडलां आनी तें सकयल आतां पोंचांनी तळ पांयाकूय पावलां. सो ते चड करून ते फंगस आसूं शकता. आनी ताणें शूज सॉक्स सामके बंद करूंक जाय, कित्याक ताका मातसो वारो लागूंक जाय. सो मेन म्हणजे ताणें कसलें तरी सँडल घालपाचें, प्रिफरेबल लेदर कसलें घालपाचें. घरान सँडल कसलें रबराचें चलता, पूण हेलोवेट फर्स्ट थिंग म्हणजे तो बंद करूंक जाय. 2-3 महिने म्हणजे खूब जाले, तो आनी फुडें चालू दवरूंक जायना. आनी त्याच डॉक्टरा कडेन परते वचून नाल्यार खंयच्या दुसऱ्या स्किन स्पेशलाक वचून ताजेर ताणें रोखडो ओपिनियन घेवंक जाय. आतां कशी कंडिशन आसा ताजेर ते ट्रिटमेंट करूंक जाय. पूण हेलोवेट बंद जसो केलो की मागीर थोडो तेप मातसो टायम लागतलो, कित्याक हाजो सायड इफेक्ट आसा ते पयलीं देंवतले, आनी ते देंवले की मागीरूच ओरिजिनल कंडिशनाक ट्रिटमेंट करूंक मेळटलो. सो ते हेलोवेट पयलीं बंद करूंक जाय.
डॉक्टर, म्हाका दिसता आमी एक ल्हानसो ब्रेक घेवया, एक विसव घेवया आनी परत सुरू करूया.
बरें.